welcome to our Night of Beauty. We're here tonight to talk a little bit about breast surgery. We get a lot of questions, just online inquiries, direct messages on Instagram about a variety of surgeries ranging from breast augmentation to lifts, also called mastopexies, and breast reductions. So I wanted to break it down tonight for everybody. We had previously asked some of our followers on IG and Facebook to send in some questions about breast surgery that they may have. If anybody has a question during the event, please direct message us or info at us on our emails. This way we can get back to you personally and answer all your questions. So we're going to break this into 3 different segments. We're going to start talking about breast augmentation. A lot of patients ask all about breast augmentation. What are my options? And the main options that you have are breast implants with saline or silicone and fat grafting. Fat grafting does not give you the same results as implants, obviously, because you're not going to be able to transfer the same volume. So we're really going to not talk about that much tonight, but if you have questions about it, feel free to send me direct messages. So tonight we're going to talk a little bit about implants. Every implant is made with a silicone shell. We have saline, we have ideal implants, which is another form of saline implants, and silicone. Saline implants have the advantage of it's made with just salt water filling, and if there's a tear or a leak in it, it will just drain out and your body will absorb it. Silicone is now made as a cohesive gel so that if there is a tear in the implant, it will stay put because it's more like a gummy bear or some kind of cohesive gel that if we slit it, it's not going to leak out, it stays there. Those are usually some questions that people ask about the difference between saline and silicone. I will mention ideal implants just because they're a newer form of saline implants, and the difference is between the regular saline and the ideal. Regular saline implants are just one chamber that's filled. Ideal implants have multiple layers. So we fill anterior and posterior chamber, and you can see the difference when you hold it in your hands about how this one looks versus this one. So it's always interesting to talk about. So how do you know what size to get? Well, there's a lot of different ways to tell, and in the olden days, people used to stick a sock filled with rice into your bra, which I think is kind of gross. Now we have sizing systems that mimic what an implant will look like inside. Those are usually really nice because then you can actually feel what it's like on your body. So we have a sizing system in our office, and usually we talk about what somebody wants as far as a look. We'll see pictures, and I kind of guess a rough estimate of size, and this is how we direct you when you're doing sizers. The next question people really ask is, well, what's a high profile? I really don't want it to sit high on my chest. And that was out there on Real Self, and high profile does not mean anything except how much projection, and I don't know if you can see that on the camera here. So I have 2 implants here. One is a moderate plus and one is a high profile. And here's how I like to show it. Assuming they're the same volume, here's moderate plus and there's the high profile version of it. It's just a matter of the diameter or how it sits on your chest wall, the width of it, that really makes the difference. They made high profile implants because people were smaller and they wanted bigger volumes, and rather than having an implant that's so wide and now you have like too much side boob that you're hitting yourself when you're walking, or uniboob because it's too close to the midline, they've made different sizes to make them basically more narrow with a little bit more projection. So that's all the difference between moderate plus and high profile. It has nothing to do with where it sits. I create the exact same pocket inside. It's just a matter of which implant based on your diameter. So now we're going to start taking just a few questions from the audience, and Colleen's going to read them off to me.
We have one Instagram question. What happens if I have asymmetrical breasts?
So asymmetry, a lot of people think that it's not common. It's incredibly common. We always joke around that breasts are just sisters, they're not twins, because most people do have 2 different size breasts, and most of it's, minimal. But if you have asymmetric breasts where they're a cup size to 2 cup size difference, we usually evaluate which side you like the best and what look you're looking to attain, and we can either correct it by reducing one breast and increasing another, or vice versa. So implant utilization for this is great because it allows us to adjust the size based on an implant and based on the amount of tissue that you have. So asymmetry isn't something to be so concerned with, but just make sure you are looking at someone who's really familiar with this, and you can look on our webpage. We have some before and afters on this, and we do see a lot of patients with this.
Another question we got a few times, how long do I need to take off work?
This is a great question. Now, with COVID happening, our world is so different. And I probably should have mentioned this before I got into different types of surgery, but so many people are working from home, so they're utilizing this time to do surgery because they're not traveling into work. We're in Long Island and Manhattan, so people tend to travel into work, whether it's cars or trains. They're not doing that anymore. So recovery is great. You don't have to see people. And if you're doing a Zoom call and you're doing breast surgery, nobody needs to see from here down. So people are taking about a day and a half off maybe just for recovery from anesthesia more than anything. But as far as recovery, it's usually about the day of surgery and the day after surgery where I would say don't make any serious decisions just because of anesthesia. After that, most people switch to Tylenol. The incision from breast augmentations for me is usually about 3.5 centimeters, so tiny. And it's more just the soreness if we go under the muscle that you'll feel. So recovery is, I say on average, about 48 hours.
Should I wait to have my breast augmentation if I haven't had children yet?
This is another question we hear a lot. If you're 20 and you don't even know if you're getting married, don't know if you're having kids, and you want a breast augmentation, have it. I don't think this should be something that stops you from doing something that makes you feel more confident. Obviously, if you're planning on having a child in the next 3 months, then I would say wait until after. Or if you're in the middle of your childbearing years and you know you want to have another child, maybe hold off just because your breast can change during pregnancy. Even people who've had augmentations before pregnancy doesn't always mean that you're going to need an additional surgery after. Everybody's body reacts differently to pregnancy. So my advice on that is if you're young and you feel that you want to have a breast augmentation now, then do it.
How do I know if I need a lift from Facebook?
All right, so when I evaluate you, I look at where your breast sits according to your fold. And the fold is the area where your breast meets your chest. It's called the IMF, or inframammary fold. If you have breast tissue that falls below this fold and your nipple and areolar complex is below that fold, then you need a lift. There are some situations where some people just have a little bit of tissue below the fold. That's called pseudotosis. Usually we can adjust for that with an implant by doing just different techniques during surgery. So if your breasts are really below your fold, you need a lift. If they're kind of almost there, it's going to be an evaluation by me or another plastic surgeon to evaluate what your goals are and what your long-term goals are. Also to see the skin quality that you have. So it's not just a yes or no answer. It really is a person-dependent question. But on a whole, if you have all of your breast tissue below your fold and your nipples are pointing down to the ground, you need a lift. So that's the long and short answer.
We got a question about a lift. Do you have to take my nipple off during a lift?
The nipple does not come off. Even in reductions, which we'll get to in a little bit, I have not done what's called a free nipple graft, since I was in residency. The nipple doesn't come off. It doesn't come off the body and go on the table. What it does is it stays attached to tissue underneath, and that's called a pedicle for a lift and for a reduction. So the nipple doesn't come off. The nipple does get moved in the sense that it stays connected to tissue underneath, and we relocate it based on taking out excess skin and kind of repositioning your breast tissue. So no nipple off.
We got an email question about reductions. How do I know if my breast reduction would be covered under insurance?
Another great question. Patients who are teachers in Long Island, teachers in Manhattan, MTA workers, police officers, corrections officers, nurses in hospitals, these insurance plans tend to all have what's called out-of-network benefits, and that's an easy way to know. If you have out-of-network benefits, we can send out to your insurance for approval. If you don't have out-of-network benefits, it gives us a little bit more of a challenge because most plastic surgeons don't participate with insurances. It gives us a little more of a challenge, but we still try every little last bit to get it covered by insurance. With that, you also have to look at the amount of tissue that the insurance company requires to take out, and the reason they do this is to say that this is a physiological problem that you have causing neck and back pain, grooving the shoulders, and they don't want it to be just a lift for cosmetic reasons. So you can understand that they don't want to cover things that it's really just because you feel your breast sad, but more for a physiologic reason. Your activities of daily living are affected by this. If you're a nurse, You're on your feet for 12 hours, you're a teacher and you're standing teaching and dealing with kids for 8 to 10 hours a day, and you come home and your back and your neck hurts and you have these shoulder grooving and you've tried physical therapy. These are all reasons why insurance should cover it. So we try our hardest to get everything covered by insurance. Usually what we ask for when you call for a consult is your insurance card, and we usually call ahead for you to see just a matter of where you stand with your own network benefits or what have you, to see and give you a pretty good idea. A lot of times insurance will deny it right away. We do a lot of appeals to try and get it covered.
Someone on Instagram wants to know, where are your procedures performed?
All right, so we're actually in my surgical suite area waiting room right now. It's become just a room because nobody waits anymore with COVID. We have our patients' families not staying in the facility anymore. But I have what's called a quad ASF. It's a facility governing body that makes sure we do everything according to code. Basically the highest standard you can have, not in a hospital. So it's a private facility where I have my own operating room, my own operating room staff, my own group of anesthesiologists that come. It's private, it's clean, it's quiet, it's discreet, and it's safe and it's clean. So it's done here in Long Island. We will be in the future operating also in Manhattan, but not just yet. I'm kind of riding out the COVID wave.
Last question I see here. What's the difference between a reduction and a lift?
So as we spoke a little bit earlier, was the reduction has to do with insurance coverage about how much tissue needs to come out to have them assume that your symptomatology disappears. That's the long and short reason why insurance covers and doesn't. In the end, the procedure is, aside from removing breast tissue for a reduction, a lift and a reduction are kind of the same procedure in the sense that we raise up your nipple, attach that pedicle, and cut out excess skin. The reduction is just that we're taking tissue along with the skin. But in the end, you're getting a lift with your reduction, because a lot of people ask me that, say, even though you're doing reduction, can I do a lift too? That's part of it. You know, we like to create nice, perky, youthful breasts after reduction. And again, it just is within the guidelines of what an insurance company deems satisfactory to relieve your symptoms of back and neck and shoulder pain.
Cool. I want to tell everyone behind the scenes, email info@blaineplasticsurgery.com if you wanted to take advantage of our surgical specials tonight. Thanks, Dr. Blaine.
Thanks.